So hello everyone, welcome to the new chapter which is gastrointestinal tract. So in this chapter we are going to study about peptic ulcer disease and the drugs which are used in day-to-day life. Okay, so peptic ulcer disease. What is peptic ulcer disease? Peptic ulcer disease is what when your stomach's HCl secretion increase, that time you got ulceration in the stomach, that is known as peptic ulcer disease. So how can you treat that peptic ulcer disease? First, you can make acid lowering drugs, and second, which you can give antacid for the pain relief. Okay, so let's study one by one acid lowering agents or acid lowering drugs, all the same. What cell HCl production is done by parental cells of stomach. There are parental cells in the stomach which produce HCl, and proton pumps which helps in the secretion of acid. So let's look at this diagram so you will get an idea. Okay, this is in your parental cell, and in parental cell proton pump inhibitors will give first, because here proton pump helps in secretion, so we will first make this inhibition, so we will stop them. Then there are PG2 inhibitors we have to give to decrease acid. Then we can give M1 blockers, or we can say acetylcholine blockers, or histamine or H2 blockers. So these four things we will do to lower the acid in the stomach. So as you can see here, acid lowering drugs. So first M1 blocker, H2 blocker, PG2 inhibitor, and proton pump inhibitors. Okay. So in M1 blocker there are two examples, pyranzepine and talanzepine. At the ending you can see zepine, it's a M1 blocker. This is a common word every drug has, like talanzepine and pyranzepine has ending. So you can just look at the ending and you can know which are the drugs. Like M1 blocker has zepine. So for H2 blocker, the same thing is there. Tidine, like tidine is there. So cimetidine, ranitidine, famotidine, and luxotine. Okay. Misoprostol you can give as a PGE2 inhibitor, and there are protein pumps in it, as I think many of us know, and many of us take in the day-to-day life also. Omeprazole, pantoprazole, imoprazole, lansoprazole, and rabeprazole. So ending is prozole. That's why I didn't write here. Remember this: proton pump inhibitors has prozole at the ending. So next drug is more specific drug for non-steroidal drugs induce peptic ulcer. Non-steroidal drugs, which are non-steroidal drugs like paracetamol, aspirin, diclofenac, and there are few more examples which you take for fever and inflammation. So misoprostol you can take for this. This is a specific drug for peptic ulcer disease which are done by due to non-steroidal drugs. But what are the drug of choice for that? Drug of choice is proton pumps inhibitors. Like you can take any pantoprazole or omeprazole. Mostly we use this in our day-to-day life. So now let's study few points about proton pump inhibitors. What are proton pump inhibitors? First of all, they are irreversible drugs. Then they are example of hit and run drugs, and they are given with acid resistant coating. So once they will give effect, their effect cannot be taken back. So that they are known as irreversible inhibitors. Then hit and run drugs. So on the side they will give effect and they will disappear. That's why they are called as hit and run drugs. And they are highly dissolvable in acid. That's why they are given acid resistant coating, so they can reach intestine and there they can get absorbed, and after that they can give effect to make inhibition to the proton pumps. So what are the uses of it? You can use them in peptic ulcer disease, then gastroesophageal reflux disease, Zollinger-Ellison syndrome. This is one disease, okay? Don't think these are three. It is given in these three as a drug of choice. And what it also have side effects. Like what are side effects? Like it will decrease calcium, decrease vitamin B12, and infections will be increased. So let's move to the next topic, which is antacids. What are antacids? Antacids are given for pain relief. Like antacid we usually takes in our day-to-day life also. So antacid, okay, they are the fastest pain reliever in peptic ulcer disease. They include aluminium oxide and magnesium oxide, and they both are given in combination. Why they are given in combination? Because one causes constipation and one causes diarrhea, so they will repel each other, as I told you in fixed dose combination therapy. So next one is ulcer protective drugs. What are ulcer protective drugs? For example, this is your stomach and this red one part you got ulcer in the stomach. So HCl present in the stomach will irritate that ulcer again and again. So to stop that irritation, we give ulcer protective drugs. So you can give sucralfate, which is act like a polymerization, act by polymerization. Then it require like acidic pH, and when acidic pH will be high, it will give its reaction. So do not combine with antacid. Always remember what things not to do, because there are always questions on the things what thing you will not do and what is contraindication. So do not give with or do not combine with antacid. Okay. Next is anti-H. pylori drug. So in anti-H. pylori drugs we give antibacterials or antimicrobials like amoxicillin, metronidazole, clarithromycin. These three drugs we can give. And there is one more thing we can do, that is use triple therapy. What is triple therapy? One proton pump inhibitor plus two antibiotics. Like you will give pantoprazole and plus two, like one of them, like two of them you will give, plus one pantoprazole or omeprazole will give as a triple drug therapy. So you can remember as CAP: clarithromycin, amoxicillin and proton pump inhibitor. And this therapy is usually given for 2 weeks to treat H. pylori peptic ulcer associated with peptic ulcer disease. So anti-emetic drugs. What anti-emetic drugs? Like you done chemotherapy, and after chemotherapy if you are feeling nausea, vomiting, this kind of feeling is there, so you will give anti-emetic drugs before operation sometimes, or after operations also there are problems, so you will give before and after, like early and delayed. So in early, what you will give? You will give ondansetron, gazinsetron and palonosetron. After delay, like after the chemotherapy has done and you are feeling nausea, vomiting, that time you will give apretant and rolipetant. These two drugs will be given to stop nausea and vomiting in the chemotherapy patients. Now there are D2 blockers. What are the D2 blockers you will give? Metoclopramide. Metoclopramide is given for because it will cause blood-brain barrier and it's got dystonia. Okay. Then another one, domperidone. It does not cause blood-brain barrier and it does not cause dystonia. It is drug of choice for levodopa-induced vomiting. Okay, this you should remember. And so with this we finish our topic.